Hi guys, how about now? Am I visible and audible to you all? Someone is taking live class of Dermat, like somewhere else in the world. That is possible, but are they taking on this link? Okay, I think now I'm visible. I've been talking for a while, as you might have noticed. I went live right in the middle of saying something, so I've been talking for a while, thinking that I'm live, but I wasn't. So, anyways, all's well that ends well. So nice to see you all, and what we are now beginning on this 30th of September is our joint effort to start preparing for one more exam, one more try that we are all doing to prepare for INICET, an amazing exam that you can prepare for, and we'll do it together, and we'll make sure that we all give it our 100% and do very well. All right, so we'll get the result that we deserve, hopefully this time around. For those of you who are new, my name is Zainab, and I've done my MBBS and MD in Radiology from AIIMS New Delhi. I've done my senior residency from AIIMS, and now I'm here on Unacademy teaching you guys. So this is Plus subscription, wherein you will get access to a lot of educators on the platform and all the courses which have been conducted and will be conducted in future. You can combine it with Prep Ladder to get iconic subscription. Look out for 10th of October, 11 a.m. Definitely attempt this. And you might just win free scholarship, and the prices are rising from tomorrow. So you can, if you are looking to subscribe, you have 1 hour 45 minutes to do so. And these are the various batches. So we have one batch on INICET 21, a 1-month batch which is starting on 29th, which is yesterday we started, and now you can make use of it. Apart from that, FMG batches are starting again from yesterday. So my course for FMG students, if there are any FMG students here, I'll be taking a radiology course from 13th to 19th October. 2 hours each will complete, and we'll take care of radiology. Okay, so that is the plan. You can use my code for subscription for an additional 10%, which is ZURA live. Alright, so let's talk about the most important topics that we have to focus on, and I'll also talk about the plan, right? कि मेरा क्या रोल है. टॉपिक्स तो बहुत देते हैं, बट हाउ आर वी सपोज टू डू. ऑलराइट, सो व्हाट आई हैव प्लान्ड फॉर यू गाइज इज स्टार्टिंग टुमारो one special class daily 10 o'clock. We call it midnight express. Alright, although it is not at midnight, so now don't start nitpicking कि मैम ये तो 11 बजे खत्म हो रहा है, why are we calling it midnight express? Because it's stuck and it will stick. Okay, so that is midnight express name which will stick around, but we'll continue to do the topic pattern like we were doing. We'll do a mix of high topics, right, every day, such that towards the end we are done with a set of good collective topics to revise. Alright, so that is the plan. 10 p.m. best time है. So starting with the topics, we'll talk about the topics and then we'll talk about the plan. Alright, so just stick around for 15 odd minutes. I'll give you an orientation कि क्या क्या plan है, आपको क्या करना है, मुझे क्या करना है. We'll talk about it. Okay, so something very important. One question you will get in INICET are all emergencies, and the most important thing here is BLS, ACLS. Yeah, so combining so all of these topics that I'm giving you, remember, and in life in general, even when I'm not giving you topics, I have given you that lesson n number of times that you integrate stuff, right? When you're reading a topic, you do it from every possible subject such that the topic is closed. It shouldn't be ki micro padhe to holistically. Anytime you're doing micro, no, how I used to study microbiology, I used to complete infections as a whole. So anytime you're doing micro, do infections from medicine, do programs of those infections from PSM, and do antimicrobials at the same time, such that that topic needs to be completed, right? So that is the one message that I want to give all of you guys, that is how you have to now make a habit of studying. And if you don't believe me कि नहीं मैम ऐसा तो नहीं कर सकते, then look at the questions, right? So those integrated clinical questions that we are all getting, how do we deal with it? We deal with it by changing our strategy of studying, and it is actually a blessing when you read it this way. Your matter reduces in your brain like in such nice folders. That is very nice. Alright, so study in an integrated manner. Yeah, PDF is not there in the group. You want the PDF? I will post it after this class is over. Okay, I also have to post eFast ka PDF, which I will also do. Okay, so first thing is the BLS and the ACLS guidelines. the updated guidelines which came about in 2020, that we need to know. So combine it from medicine anesthesia, right? This is a topic we shall be doing in Midnight Express. So जो भी मैं tick लगा रही हूँ ना are things which I am committing to that we will do before your INICET. Alright, so this is something that we will be discussing. Moving on, trauma. Trauma is very, very important for INICET. And if you looked at NEET PG also, right, do you think that trauma played an important role? There were 4 questions. 4 questions is a lot of questions out of 200 questions. And you have seen कि 4 questions लोगों के ranks thousands में बदल रहा है, right? So this is something which is very, very, your comments have stopped or you guys have become very silent? Yeah, you guys have become very silent. So trauma is very, very important. Alright, so it yields you a lot of questions and we have to do it in an integrated manner. Predominantly, we do it from surgery, we do it from radiology. Yeah, so this is something that we shall definitely be doing. We have done it in the past. We'll revise it before your INICET because this is a sure topic from surgery that gets asked. Okay, हाँ ठीक है, सुनो शांति से सुनो. So this surgery and radiology, very, very important. Okay. So again, those of you who are saying कि ये तो INICET के topics है, again these are NEET topics also. These are topics which are must know. 20 topic है जो तो करने ही है, उसके बिना नहीं जाना, right? So it is that kind of a list. So this is trauma. Third thing, instruments, lines and tubes. Most of these we have already covered in our BTR sessions in our previous Midnight Express. I'll try and include more. Alright, so core surgery instruments, I think it is best अगर आप specialists से पढ़ो who are using them, you know, rather than me as a radiologist. So if somebody else talks about embolizing agents, they would not do a very good job at it. So similarly, if I talk about surgical instruments, if I talk about छोटे ophtha के instruments, I would get them wrong, right? So those are things that I want, although I put a tick, these are things I want you to do from specialists, right? From faculty of specialist subjects. Lines and tubes, we will again revise one more time in the due course of time. Alright, so this we have already done. फिर बात करते हैं the golden highlight of last INICET, right, which was pap smear, which yielded a lot of questions, and carcinoma cervix. This is something which is very, very important. It has been ever since a lot of years. Even when I gave the exam, pap smear, CS cervix, all the gradings on pap smear, the management of different things like LCIL, HCIL, everything was very, very important. I don't know why this came as a shocker this year, but this has always been a very important topic because in AIIMS, the biggest projects which run are on CS cervix. Alright, it's the nodal center for CS cervix, so that is why the biggest research, and now the head of department of Obs and Gynae is the BAM is working on CS cervix. She's dedicated her life on this, so you are gonna get a lot of questions on this again. So this becomes a topic we just can't afford to miss. We will do this. Alright, next is labor, partogram, fetal monitoring, the whole delivery part of things. Alright, so presentations, how to manage complications, what is intrapartum fetal monitoring, antenatal fetal monitoring, partogram, again always a favorite topic of examiners. Also remember, on the same lines, Obs Gynae, extremely special topic for INICET. Alright, so this is something which gets an extra importance vis-a-vis NEET PG, wherein this has a very, very high weightage as far as INICET is concerned. Alright, so this is definitely a subject you can start with if you are weak at, but you just can't afford to leave it. Okay, फिर PSM की बात करते हैं. Again, just like Obs Gynae, PSM has a lot of soft corner for examiners of INICET. You will get a lot of questions, but will these be questions like NEET PG? Ancient questions on environment, ये candle and lux और ये सब? Not really. Environment or kachra stuff of PSM, not very important. What is the most important in PSM as far as INICET goes are all facts, are all numbers. Alright, so sorry for that. So just a second, yeah. So epidemiology, biostats, screening. Have we done biostats already in Midnight Express? We have, right? So we've done 2 Midnight Expresses on biostatistics. We've covered it extensively, all that you need to know, the advances. Epidemio mein we have done the evidence-based medicine ka triangle, if you remember, the pyramid, I mean not the triangle, the pyramid of evidence-based medicine, which is again something which is a hot topic. Apart from that, the other things from epidemio and screening we will do. Alright, so most of these things I have included. I will try and cover in the upcoming Midnight Expresses through the month of October. I want to finish all of these. Alright, if you have any other ideas, just run them by me. Gande gande topics mat dena. Like last time you had given me some very weird topics like ichthyosis and all. Those are very tiny topics which are not very high. So if you have good ideas for high things, you definitely tell me. Okay? Fit. Blood products, blood transfusion, that is also something which is very important. New chapter of Robbins is something that you need to know. Apart from that, complications of blood transfusion, infections by blood transfusion, that is again very, very important. Then comes oncology. ठीक है, तो ऑन्कोलॉजी में अगेन यू आर सीइंग वी हैव टू कंबाइन एवरीथिंग, वी टेक एवरीथिंग टुगेदर. इट्स नेवर कि फार्मा में से एंटी कैंसर ड्रग्स पढ़ा. डू इट टुगेदर विद नियोप्लेजिया का पैथ का चैप्टर. ऑल द टेबल्स इन दैट chapter are so important. I can't even stress enough. Cancer stagings of all subjects, this we have done. We have buri tarah ratod this, and I'm sure all of you guys who were there with me, you remember this. And Rad-Path, this is also something that we've done, right? So pharma we'll see if we can do. Apart from that, this also quite a lot of it. Immunohistochemistry, tumor suppressor, we did do this all. Alright, in our Midnight Expresses, and we are gonna be revising. Yeah, this video will be there on YouTube. Yeah, abhi to rahega at least. Okay, so this is oncology. Then toxicology. Toxicology से अपने को याद आता है हमारा deleted session, the crash course, but we'll revise it. Alright, so we've revised the crash course in the FMT rapid revision, so we'll get that link also. So combine it with all the subjects, all the antidotes, all the poisonings, toxicology. That is very, very important. Yes, Shalmali, I definitely agree with that topic, and you'll see it figuring in this list itself. Biochemistry cycles and overview, all the cycles along with inborn errors of metabolism. So in carbohydrates, glycogen storage disorders, lipids, and do all the lysosomal storage disorders. So along with lipid, do amino acids. So all of these things go hand in hand. Do all the enzymes which are rate limiting. Along with that, pediatric chapter, inborn error of metabolism. Contraception, we've covered it in our Midnight Express already. So this gets covered. PSM plus OBGYN from everything. The government aspect of things, the free contraceptive agents which are sold, those are more important than the gynae aspect of mechanism of action. Alright, so contraception के बारे में niche questions come. So definitely Midnight Express, we have to see this. Alright, acid-base balance and electrolytes. Do you think this is important? What did NEET PG teach us? 4 to 5 questions on acid base alone, and not even numericals like we were expecting, right? They were simple, just guess the type of acid base imbalance. Again, something which we have already covered. All the things who are जो नए बच्चे हैं यहाँ पे and feeling कि already covered का क्या मतलब है? Where has it already been covered? I will tell you. I'll tell you everything, how we are gonna revisit this again, so that the new people can also join in, and the older people who have seen it can revise it. Alright, so that we have all of these topics down. I don't want कि past history में हो गया उसका मतलब हो गया. No, we are gonna do it one more time before INICET. We'll revise it again. Yeah, so we will not do it extensively. I will tell you where to read it extensively, and then I'll give you questions on that. Alright, but I'll take care of these topics. Okay, going on to the next one, nerve injuries and various tests. Again, always in INICET you will see a question, always in NEET you will see a question. So now those of you who know, those of you who have given INICET and who have given NEET PG, what I want you to do is judge this list right now. I don't want you to take this list on face value कि दे रहे हैं तो ठीक ही होगा, मान लेंगे. No, go back into your mind and remember the last INICET you gave, remember the NEET PG that you gave, and just confirm कि अच्छा इसमें से सवाल आए हैं. Do I think it is important? Am I confirming this? So you confirm it simultaneously. किसी भी चीज़ को ना face value पे नहीं लेना. अगर लग रहा है कि reliable है तभी मानना है. Okay, so this is something, again, it is something which has gotten a lot of questions. Yeah, so anatomy, physiology, orthopedics. Then what Shalmali told us, coagulation pathway, again very important. So this combines with path plus the pharma का हिमाट का जो chapter है ना, क्या बताऊँ, इतना important है. If pharma में you want to do just one chapter, पूरी फार्मा में एंटी माइक्रोबियल जैसे गन चैप्टर, एंटी कैंसर जैसा गन चैप्टर, which is most important, which gives you the most questions, it is actually HEMAT, right? It's actually HEMAT का pharma which gives you a lot of questions on anticoagulants and all antiplatelets and everything. Yeah, so this is again something which is very important. STIs, we've done everything about it, right? We've done STI kits, अभी तो सबको याद है मुझे. I have STI kits on my tips for no reason, right? So STI kits, very very important. All the features, all the images of STI kits is very very important. Nephritic syndrome, nephrotic syndrome, from medicine, path, pediatrics, everything about these. histopathological appearance पे हमारी हमेशा लग लेती है. Electron microscopy, these are all very important images that we need to know, right? Scores and classifications, this we have done, right? So ये भी again we have done 2 BTRs on this, and we will again do this BTR towards the end. ये हम कब रिवाइज करेंगे? ये हम रिवाइज करेंगे नवंबर के लास्ट वीक में, ठीक है? सो यू जस्ट लीव this we will do towards the end. Genetics and molecular biology, again this is INICET special. This you will not see figuring too much in NEET PG, but INICET में हमेशा, AIIMS में हमेशा till like 2014-15 when I gave my exam, तब से ये टॉपिक बहुत इंपॉर्टेंट है. माइक्रो RNA, एपिजेनेटिक्स, all of these things are so very important. अभी तक सेम सवाल आया, लास्ट टाइम भी सेम सवाल आया, नॉकडाउन नॉकआउट, same thing came in my exam also. So remember, over 5 years this topic is still not gone out of the window. Yeah, so this is something which is very very important, and we combine it with path, biochemistry and pediatrics ka genetics aspect of things. Okay, finally hepatobiliary, again INICET loves. Do you remember every time they give you a different question on biliary? Like किसी बार biliary leak का stage they will ask you, then they'll ask you next step, sometimes they'll ask you most sensitive. So they're not leaving it, right? And you guys are also getting trapped with the same topic. They keep changing the question, but they are telling you that I'm going to ask you this. It's like कि पहले से बता दिया है, ओपन बुक होता है ना जब एग्जाम, कि ये क्वेश्चन आने वाला है, आप देख लो, कैन यू सॉल्व इट? एंड वी आर स्टिल स्ट्रगलिंग, राइट? सो दिस इज समथिंग दैट इज must. We combine it, surgery, radiology, that is very very important. Yes, MRCP, ERCP, I don't know when that trouble will end. That concept somehow is not going only to our brains, and even if it goes into our brain during class, somehow exam में सब कुछ mix up हो जाता है, right? And last is vaccine. So all the schedule of vaccines and everything about vaccines is again very very important, right? A few things that you guys have told, and I really want to include them into this list also, and something that I will consider during Midnight Express. One is vitamins, because again that is something which is very very important. Optic pathway is also something that we'll try and cover. Any other things that you want, you can tell me. Can I show this as a list? Why? मतलब उससे क्या फ़र्क पड़ेगा अभी? तो I'll send the PDF over, all right? Or just when I'll send the PDF over on the group, और ऐसा. Porphyria हो गया. All right. So now, if I will wait for your comments later on, you can post on the group also all your requests. But something molecular genetics हो गया ना, right? Apart from that, immunology, yeah. So immunology also is something which is important. Apart from that, abhi ruko, don't tell me your comments. What is the plan? Let me tell you the plan first, and then I will tell you. Okay. So those of you who are new, just type in a yes if you guys are new कि अभी तक क्या चल रहा है, ये तो हो गया, ये तो होगा, का क्या मीनिंग है. If you are new here and you are thinking कि मैंने तो पहले नहीं लगाया, I have vague idea about what Midnight Express is, but मैंने अच्छे से नहीं किया, but I want to do. If you are that kind of person, type a yes. Okay, so that I know that there are people. Okay, so I can see at least 2 new people here, partially. ठीक है, तो what we are gonna do is I will tell you what is the plan. Okay. So from tomorrow, what we are going to do is, right, a lot of yeses now. So what we are going to do is, इतने classes पुराने हैं, right? These are Midnight Expresses which we have done in the past. These are all the topics. I will include them in the PDF that I am posting. I've already posted. If you have seen the group, what group? Radiology with Dr Zainab Vora. It's a public group on Telegram. You can join it. Okay. On that, I will be constantly posting all the links of all of these free classes. All of these are free classes. There are 56 classes which we have done. All of them have very, very high topics which we have already covered. Right. So now if I tell you कि बेटा 56 class देख लो, almost 1 hour का, it will be very difficult for you, isn't it? So what we are going to do now is we are going to take baby steps. So every time we are doing a new Midnight Express. Like tomorrow is Midnight Express 57. I will give you a homework when I post the topics ki aaj isme in the morning when I send you the link that this is the link of the class, you enroll to it. What I will also tell you, I will give you the topics which I am going to discuss. You can read it prior to it or you can plan it accordingly. बाद में भी पढ़ सकते हो. The second thing I will tell you is in this I am going to revise Midnight Express 1 and 2. So on and so forth. So every day we are going to discuss 2 Midnight Expresses. So what is your job? Just before the class, anytime before 10 p.m, just see these 2 classes on 1.5x or 1.25x. इससे ज़्यादा follow नहीं कर पाओगे शायद. So 1.25 और 1.5x पे ये आपका homework है. Not just to see this Midnight Express. खाली देख के नहीं आ जाना. You are reading this from your notes. These are topics वो फिर आपके हो जाने चाहिए. ठीक है, वो topics over है. So simultaneously towards the end, when we are done with all of these topics, you have to finish all of these, right? You can't say कि ये topics मेरे रह गए, अब मुझे revise करना है. No, this is it. Alright, so you do it from all your sources and you do it from here. However you feel comfortable, consolidation जहाँ पे भी करना है. Make one new छोटी copy. Those of you are starting now, पता है मैं क्या suggest करूँगी? Just buy a new book. एक नया बुक ले लो for all midnight expresses and whatever are the volatile points. पूरा पूरा नहीं लिखना, volatile points है, साथ साथ लिखते जाओ. So every day you revise this. On the second day, now when we are doing Midnight Express 3 and 4 का revision, you first read your छोटी copy and then you start off with this, right? So this is what I would suggest, that you make handwritten notes. PDFs also, if you are a digital person, this छोटी copy can be digital, wherein you can use the PDFs as a base, right? So either ways, that is completely your choice. If you use all the PDFs, it will be like 1000 pages. So that's the only problem, and I somehow feel more confident when I'm writing stuff, and then you can see the images from the PDF. So this is what I would recommend you to do. How does this sound? I will include 5 to 10 MCQs from these 2 things in the class. Alright, so towards the end we'll do 5 MCQs from these topics such that it's like a test. ठीक है, this is closure for me, right? So this is closure and then new topics. Okay. Alright, so this is the plan from tomorrow for at least 15 days. This is what we're gonna stick to religiously, and hopefully we'll continue from there on. Any other things that you want to request? Abhi already I have a lot on my hands, like so many topics. So these are all topics which I feel are very, very important. So let me cover them first, and then in बीच में छोटू topics है which you want me to do, which you feel are high, definitely tell me, because we'll keep one large topic, 1 or 2 छोटू topics, and we'll complete, right? So we'll try and revise as much as possible, and we'll also include thoda radiology also in between, because that is also something which shouldn't be lost on us. That is something which is my primary job, isn't it? So that is what we will do. So schedule I gave yesterday, Ganesh, to definitely stick to it. This is all bonus, right? So special classes are all bonus, and this is a part of your day, right? The other part of your day goes into your schedule, into your subject-wise syllabus. Yeah. So you modify it according to yourself, but these are add-on topics. These are topics which are side apart from your subject-wise and system-wise division. Yeah. Plus classes, so there is FMG course, and then there is a clinical examinations via batch which will have 5 hours. So all of those classes are after 13th of October. Alright, so till 13th of October, when I don't have plus classes, I want to get this done, bulk of these topics. Alright, so that's the plan. How does this sound? Everybody is happy and feeling confident, and now over NEET PG. So again, we need to be over it. We need to move on from that. It is 10:37 of 30th September. बस 12 बजे तक अपने पास टाइम है. 1st October, I'm a new person, it's a new day, and we are all starting afresh. Yeah, so we are all starting with a new exam, with a new mindset, getting over what has happened in the past. It doesn't define me, it doesn't matter. Okay, it was a bad day. Hopefully now I will give it my best shot, and I will give it my best shot. बस बाकी देखा जाएगा. So do not do it for the result, do it for the journey. That is very important, right? So enjoy this process. All of these are free classes. Yes, 10 o'clock, Aditya. 10 o'clock on Unacademy. So definitely download the app. Those of you are very new and only using YouTube, definitely download the app. It is absolutely free. So definitely you have to do it. INICET PYQs will definitely do. So Unacademy also holds these marathons, right? Wherein all the subject PYQs will be discussed. So definitely we'll do that. We'll do that also. All right. So this will continue with the Midnight Express theme as it's been going, high topics, such that towards the end we have a collection of मस्ट डू कि इतना कर लिया तो अपना लाइफ सेट है. दैट इज माई होल एम विद दिस. ओके, सो वो करेंगे. ठीक है. ऑलराइट गाइज. Yeah, psychiatry, thought disorders, stream disorders. Yeah, I think the main problem comes in the headings and classifications, right? कि thought disorder क्या है, stream disorder क्या है. So I'll definitely do that. Okay. Radiology with Dr. Zainab Vora. My name is Zainab Vora and I teach radiology at times. So that is the name of the group. Okay. I'm trying to show you my name, which is like far away. Alright, so anyways, I will post this PDF and you'll get it on the group. ठीक है. Alright guys, so thank you so much and have a great night. Enjoy this last 30th September that you have and that's it. Okay. Alright guys, so thank you so much. और cadaveric anatomy we've already done, Gaurav. Alright, so what we'll do before your exam ना, अभी एक और बात सुन लो कि नवंबर में जब जाएंगे तो अगर मैं जिंदा रही and I am fit enough, then we'll do our rapid revisions again, right? So we'll do our BTRs and rapid revisions again like we did before NEET PG. So last 1 week mein, you know how I become in last 1 week, right? I become like you guys. I become very panicked. So that is what we'll be doing in the one last week. We'll do rapid revision fatafat of all the subjects and we'll do BTRs again very quickly. Okay, so that will be the plan. Okay. Alright guys, so thank you so much. Telegram group name again, Radiology with Dr. Zainab Vora. Somebody write, no? Somebody please write that on the comments. Yeah, you can watch previous BTR. You will find all those links in the group. सारे links group पे मिल जाएंगे. Okay. What schedule yesterday? There was a special class yesterday where we discussed a schedule, a study plan, what you should be doing. So that class also you will see. So how to use the group also, because that group also is very diverse. So what you have to do is click on the pinned link. Alright, अगर गप्पे मारने more than welcome, but you click on the pinned links, you'll find all the links, okay, which are there of the class. Okay, alright guys, so thank you so much and have a good night and enjoy.